Hello, everyone. Welcome to MED Media Show. Today, it's my great pleasure to have Dr. Amanil Haile, who is the head of the Health Bureau of Tigray. And we'll be talking about the health challenges in Tigray region and with a focus on the recent outbreaks in the region, malaria, anthrax, and so on. Dr. Amanil, welcome to MED Media Show.
Thank you very much, Professor Getachew, for having me.
Great. It's a very important endeavor to hear from the horse's mouth, as they say, because of the communication blockade and all kinds of communication challenges. There is little we know about what's going on there. You were the executive director of Idle Hospital, and you are also heading the medical school. And with that background and your recent appointment at the head of the Health Bureau of the region, I think there is no one better than you who can speak about this subject matter. So can you paint a picture for us on the state of health infrastructure and so on in Tigray compared to what you had before November 2020?
All right, thank you again. So as WHO say, in order to say that the health system is functioning, there need to be at least 6 major components: leadership and governance, the health workforce, the healthcare financing, health information system. You need to have the medical products, medical technologies and vaccines, and you need to also have service provision. So if you just evaluate how well the health system in Tigray is performing right now using those 6 components, you would say it has literally collapsed. There's no way that you can get data about health from the districts because there's no telephone communication, no internet communication. So whatever data existed before the war was also completely destroyed. And whatever data we're getting usually comes through partners, NGOs, partners that are trying to operate in Tigray with whatever supplies and human resources they have. And a significant number of them are not in their workplace, and those who are already trying to serve their people have not been paid for more. So you can imagine how difficult it is to provide service 24 hours a day, 7 days a week. It's very difficult. And with regard to health financing, there hasn't been budget for any of the institutions and the rest of governmental institutions in Tigray as well. So with medical products, technologies, and vaccines, Tigray Health Bureau had planned to receive a significant amount of supplies, but only between 5 to 66%, 5 to 6% of what it has receiving. It's just a little. And there are a lot of health partners trying to operate, including UN institutions. But the significant problem is that they are not allowed to bring in medical supplies. They are not allowed to bring in as much. In fact, the amount of cash they are allowed to bring into Tigray is so low that some of their operations are postponed. So this is the real situation. And the health service provision, you need to have all the components that I just mentioned above to say you're providing healthcare service. Of course, the healthcare professionals are really trying to stay around and they're trying to serve their communities with whatever could get there and so on. it's an uphill battle. It's just never trying to lose hope. Otherwise, you wouldn't imagine that. Asked me a few years ago if I would be working in such a circumstance, then I would say no. And what makes it heartbreak is the government of India, which is supposed to be the government responsible for Tigray, is deliberately doing it. That's what I can see. Vaccines, for children. I have friends here working with me of newborns, 2 months old. They're looking for vaccines from health to the end. I was just checking yesterday, the day before yesterday, they said we're just waiting. And UNICEF has been working to clear vaccine from this, but have waited for weeks to the clearance. So for the last several months, vaccines which are provided to countries like Ethiopia for free by international institutions like Gavi, they're not coming into Tigray. So the situation is really desperate. No laboratory supplies. Some private laboratories try to smuggle in laboratory reagents, but the cost is so. People do not have cash at hand. Trying to help people without having those laboratory investigations is very difficult. Like in Eider, a few months ago, we had about 14 patients in a span of 1 month with heart attacks, and we were not able to confirm whether it was really a heart attack. So you have to rely on your skills to decide what to do. And you don't find all the drugs, so you try to somehow improvise. So very difficult. Oxygen supposed to be easy. We have the machines here. They need spare parts, and the spare parts are always made available through the manufacturers via Addis. So unthinkable. With all the machines, it has been more than a year. You cannot maintain them. So the list is really so long. And cancer patients who require radiation therapy, they have to travel to Addis, but that's again impossible. So those staying here, you have to treat them because of the shortage of surgical supplies or anesthesia supplies. Those who are on the waiting list are increasing in number from day to day. If you succeed in operating and you want to give them drugs, chemotherapy, you don't get it. So there was a time when we had drugs that passed the expiry dates, and we said, let's try. And patients also knew, we told them, they said, let's try. So even those drugs that are past their expiry dates are no longer available in public hospitals, so they try to buy them from private pharmacies at a cost of thousands of birr, which is a lot for living Tigray right now. So very desperate, really desperate.
Maybe because there is still a breaking up. Let's try by turning off your video, and I will show you picture so that if because it's very important information should come out. Okay. So on the same, I mean, what you are painting for us is a very bleak picture, and it's very sad that no cash, no medical supplies, and I mean, doctors normally in normal days would be well-to-do, at least relatively in terms of the living standard there. How are you keeping with your staff in general in the region? You can zoom in into Eider as well. So how are people, your doctors, your medical doctors, nurses, managing even with the siege, with the no salary, no access to bank account, all that?
Mm. So everyone is to survive in their own way. Some of us have moved back to our families' houses. You know, a family of four, we try to come together. If someone is working at an NGO and they somehow get salaries every once in a while, then they support you. As beg from friends, and still others they try to get money sent from abroad or Addis, and you don't get exactly the same amount in Tigray. A significant portion would be taken by are transferring money. So very difficult. Some even don't have anything, so we're trying to provide food for them. Here in at Eider Hospital, for example, about 300 doctors get food, you know, the same kind of food, and whatever crops are available. TAFE is now luxury here, so you have it. So if you get rice, you get millet, whatever you get, you just try to give them. So that way, we have survived for more than a year. It's really a miracle. I cannot, use a bit for because every month we are counting on this will come to an end. People doing this will come to their senses and allow our health professionals to keep on serving their people. So we try to survive in a number of ways, and there are also our partners abroad that are trying to money, which is really amazing. I would like to thank them from the bottom of my heart. You know who you are, at least for some time. Will not mention your name, but you know whatever amount of money we give to our staff could be 1,500. It really helps. Some organizations like ICRC, they also try to provide, flour, a liter of oil, 15 kilograms of flour, and 20, about half a kilo of salt. They did this a couple of times in the last 3 to 4 months. So this is how we're trying to survive.
Our viewers, I'm talking directly with Dr. Amanel Haile, who is the new head of the Health Bureau of Tigray. We have to turn off our videos, including mine, because of what you are sensing, the breaking connection. And this has been the case for the last 2 years, I must say, since November 4, 2020, where Tigray is cut off from the rest of the world through communication, road, air transport, and medical doctors, nurses, and other professionals, government employees, public sector employees, haven't had access to their own banks and not receiving salaries. Dr. Amanel, you were mentioning about vaccine. I think I don't think we heard you clear, but you're mentioning about 5 to 6%. So maybe can you speak to that? Because I know Tigray, as you were mentioning before the war, was doing well in terms of timely vaccination, all that, and so on. So can you speak to that, where we are in terms of vaccine and so on?
Yeah, so pharmaceuticals in general, including vaccines. So we're getting only 5 to 6% of what we need to run the health system. And when we talk about vaccines specifically, right now, we don't have vaccines for children. So parents who are our friends, even here in Mekelle, are waiting for a miracle to happen. So UNICEF is responsible for bringing vaccines to Tigray. So they are trying to bring us vaccines, but they were not able to get the clearance for several weeks now. I don't really understand why that's happening. This is not the uh, the product of the Ethiopian government, or the Ethiopian government did not buy this. They are responsible for sending it directly to us. If not, they should report to the institutions that are supporting vaccines, to do it themselves directly. So it's a paradox. And as you just said earlier, before the war, the proportion, the percentage of children who were fully vaccinated was above 80% in Tigray. So parents understood how important vaccines were for their kids. So they have no problem of accepting. And the problem now is availability. We don't have the vaccines now. So the list is really so long. Basic items are not really and when it comes, it's just a trickle. Finish it in a fixed time, and then you get back to where we were, like tuberculosis. And tuberculosis is not a simple disease. And even worse, there are those who have tuberculosis that is resistant to the first-line drugs. So you need to take care of those patients in a special manner. So they haven't had their drugs for several months now, and no, even going to come. Cancer patients. I'm not sure if you heard me earlier. We don't have the option of our patients traveling to Addis for radiation therapy, and we don't have chemotherapy at hand, so they're just waiting. Family planning, no. Even drugs that are used for normal delivery, a drug like oxytocin, quite a significant proportion of the health institutions do not have them. Oxygen, there are several days when we run out of oxygen. So antibiotics, intravenous fluids, the list is really long. I will not bore the audience with the details, but the situation is really very difficult.
And one of the things that comes to mind when we talk about health and specifically patients is women and children. You mentioned about children in terms of vaccine and so on. So, but there is also the issue of malnutrition, lack of food, and even for women, whether it's expecting mothers, nursing mothers, including those. I mean, in the report there were hundreds of thousands of women raped, sexually assaulted, and so on. So what do we know so far about these groups?
Yeah, so women as well, they're, those who pregnant are getting pregnant because family planning supplies are not available. And whenever they get pregnant, they don't have the means to travel and have antenatal care follow-up. And those who do not get optimal service. So when you compare the portion of women who are pregnant, are having follow-up during pregnancy, and those are also delivering at a health institution with the help of skilled birth attendants. And even after birth, having follow-up, it has significantly gone down, incomparably low with what Tigray had achieved before the war. And sometimes I'm not sure if some of our audience are from the medical background. There's a drug called oxytocin, and every who comes to deliver, immediately after delivery, she just receives that drug. And just last week, some of my colleagues who had traveled to southern part of Tigray were telling us in a formal meeting that they met a woman who had to be referred to another health institute about 25 kilometers away because this drug was available. and they had to carry her on their backs. And those who could sell cattle again have to pay thousands of birr to arrive at healthcare institutions. It's becoming common. And diseases like fistulas, obstetric fistula, this is an abnormal communication between birth canal and the urinary bladder, or even with rectum. So they just become incontinent to urine or feces. And before the war, the cases were really numbered. It was about to be eliminated. And now we're having them back again. The doctor who works at the Fistula Hospital, our colleague, Dr. Malaku, was telling us a few weeks ago that it feels like he is, getting back to, decades ago again, having women have to go undergo labor for days, and then the child does not come out. Finally, delivery happens in various ways, and but they end up having a fistula. So this is the suffering of mothers. And whenever they give birth to children, stillbirth is happening, very low birth weight, and they have to, get the mothers need to get proper nutrition to bring them up properly. A very bleak moment for mothers in Tigray as well. So the women who had been sexually violated, very sad. We're still having them. Those who were sexually, raped more than a year ago, um, they just come to either hospital, for example. They tell us some horrific details. You wouldn't imagine a human being would do it on another human being. Very difficult to even comprehend. A couple of our colleagues working in our hospital are even writing, books. They write them and talk to them when they were first witnesses. They just talk to one who had experiences, and they're writing their books. They just wanted to get published. So I just want to share this with you as well.
Mhm. Thank you, Dr. Amanel. One thing that people were fearing as well is these patients, like, for example, with HIV,
Yeah.
and if they are not getting their regular medication, and the transmission, given the condition they are in and so on, it might, spread big and in large numbers. So what do we know so far about those who should get this kind of medication on timely basis?
Yeah, so if you just take every patient, more than nearly 45,000 of patients, HIV patients, were receiving care in Tigray. Now, nearly half of them are unaccounted for. Nobody knows where they are, let alone, understanding whether they take their drugs or not. So you're right. Here is they might have passed away, or they still stay alive, and the virus might even mutate. We may even have, strains that might respond well to drugs that we're using. So we have a lot of work to do, when the time comes to check whether the HIV virus is still to us that giving the even the quality of care, the HIV virus affects these who want to whether the immunity is being or not. There was a test called CD4 count, and you would like to know whether the virus is being suppressed or not. So you want to know the viral load. These are not being done in Tigray, even in either hospital. So there is, I think, maybe one hospital in the entire Tigray region that's trying to do this test. So again, challenging. Nutritional support that used to be given for them are no longer available. So we're trying to do whatever we can. A few months ago, HIV patients even had to borrow from others. They had to give drugs only for 7 days and telling them to come back after a week. Some had to take even drugs that were past their expiry. Again, very difficult. And these drugs, unfortunately, are not bought by the Ethiopian government. The Global Fund is the one that provides countries like Ethiopia those drugs for free, including for malaria. What we really want our audience to take note of. We want them to contact the Global Fund. Do they know what's happening in Tigray? If the Ethiopian government is receiving on behalf, why are they not sending them? This is most important that everybody needs to ask globally. The HIV patients have rights to those patients.
Mm, mm. I think even if it's breaking, I think you are underlining the fact that medications related to HIV, malaria, and others, they are not even bought even in normal days by the money from the Ethiopian government, but from the Global Fund. And the fact that the Ethiopian government is not allowing these medications to go into Tigray in a timely manner in the required quantity makes the problem double, because it is just blocking a globally funded medication. That's what you are saying, right?
Exactly. Vaccines, Gavi, Global Vaccine Alliance, Ethiopia is not buying them. We're supposed to get it. It's every child's right to get the vaccines. So that's heartbreaking indeed.
I hear you. And before we go into the current outbreak, my last question before that would be, do we know anything? Because given that the whole Tigray is not under your government's control, for example, Western Tigray, Eastern Tigray, and some of the Northern Tigray as well. Overall, what do we know about the health state of these parts of the Tigray? And then in terms of death rates, for whatever reason, malnutrition or health, lack of medication, all that, do we have a fair understanding of what that scale could be in terms of number of days that's happening every day?
Yeah, really very difficult. We had a couple of studies by partners working in collaboration with the staff of College of Sciences, where I used to work in the regional bureau. So the data would available fully coming weeks. So we would know, how many mothers died since the war started until recently, and the same newborns for children under as well. But the data that's coming, it's so fragmented. It doesn't come quickly when it's happened. In the past, when like maternal days used to be reported, at least if we say it took time, within a couple of hours from the farthest district, then it reaches the center here in Mekelle. So people would know what happened to that mother, and it used to be investigated. Now even the outbreak reports are coming a couple of weeks later, and not from all waradas. Like if right now the highest number of districts that reported their health performance and outbreaks were only 54. So a significant proportion of them are not reporting, and the ones that are not reporting on time, and it's very incomplete. Not from all the health institutions, and what's happening in the community is not known. As I said earlier, mothers are not delivering in health institutions. So if this occurs in the community, you would not. I just came from a meeting that I had a few hours ago with the health partners, and they were really shocked by the number of newborn cases who were admitted to the newborn intensive care unit, fetal intensive care unit, Tigray hospital. So we were having days on average about, we can say 15 per week for few weeks now. So I can send you that data as well for your reference and reference of your audience.
Okay, great. Yeah. I mean, even the fact that we are having very, very difficult communication with you. I mean, as the cabinet member of Tigray, if I cannot communicate, smoothly with you, I can imagine, and our viewers can imagine the level of difficulties that you are having within Tigray. So let's go to the outbreak. So 4 or 5 days ago, or even more than that, we heard that there was a malaria outbreak in 10 districts in Tigray, and anthrax and so on. So given where we are now, after the first data came, and we reported it on UMD media website as well. So what do we know? So what do we know at this moment as we speak today, Thursday, July 28th? What is the state of outbreaks in Tigray? Dr. Amanian.
Yeah, so to just give you background, the last epidemic that was seen in Tigray was 5 years ago in 2017. And, malaria was well controlled with a proper public health interventions like regular spraying of chemical and using insecticide-treated bed nets, and also quick detection of cases and treatment. Malaria was most a non-threatening illness in Tigray. But since June, number of cases of malaria started to increase. And again, these numbers only from those districts that are reporting, though incomplete. And we're having more than 2,000 cases a week, was last week before, and more than 10 districts in Tigray are already having outbreaks of malaria. And what is worse, the last time bed nets were distributed was 2 years ago, and just before the district distributed those bed nets to households, the war broke out, and we all know what happened to whole farmers in Tigray, and just having nothing. And we're just asking, who understands malaria in Ethiopia would know that this is not a major transmission season, even not a minor transmission season. Malaria cases used to build between December and December following the major rainy season, or the minor transmission season is usually in April, or we're having it in July. And one of the experts who spoke to me, who said worked in for some time, said he has never seen malaria outbreaks occurring in July. So unless we have quick and concerted response from internal community right now, we are for a significant trouble. And our people are already malnourished and they're displaced. You can imagine they're not going to cope. And this is a farming season. We don't want our farmers to lose their farming days. This is a very precious moment for them, especially so now at this very time. So this is the situation with malaria. Maybe one more thing, what makes it worse is cases being caused by malaria called Plasmodium falciparum. It tends to cause severe kind of malaria disease, and the mortality tends to be very high. And malaria tend to be life-threatening for everyone, but especially so for children under 5 and pregnant mothers. This is the situation with malaria, even with anthrax. It's um, human anthrax cases happen because anthrax is too old. So again, for nearly 2 years, animals' lives in Tigray not vaccinated for anthrax. All drugs not available. So we're having lots of anthrax cases for more than 4 months. Reports are from all zones. So it's becoming common. But anthrax vaccine is available in Addis Ababa. FAO, the Food and Cultural Organization, was also to help the blockade stopped the supplies for animal health. So it's just spreading in all the districts. Farmers, they are malnourished. They just eat meat of those animals, and that complicates the problem. So a lot of people tend to be affected. So our audience needs to put a lot of pressure on international organizations to act so quickly. Another outbreak is rabies. So rabies here in our part of the world tends to occur as a result of dog bites, and there are a lot of stray dogs here in Tigray, and stray dog management requires some chemicals. These were not allowed to come to Tigray as well. And vaccines for animals, including dogs, are not available. And when people are bitten by dogs, they cannot have, after the exposure, the vaccine that's given to human beings was available for a very long time. Even now, meeting that I just mentioned about earlier, we were reporting cases from Mekelle who were bitten by the same dog, and they just came to identical scare. Nothing can be done for them. Again, the world has a goal, to have no rabies days by 2030, but here we are in Tigray begging for vaccines available in the country. And diarrheal illnesses are increasing. We don't even know if we're having cholera cases and they're dying here and because we can't confirm it, we can't send our staff quickly. So we're just asking for cholera vaccine, which would really have helped our people from getting the disease in addition to other hygiene measures, of course. So this is another frightening trend again. We had a few cases from the area, even at our hospital, 3 patients a few weeks ago. It didn't look like cholera for us, but we did not know what bacteria caused the disease. And with that risk, the likelihood that cholera outbreaks might happen are there with COVID. Only LACT is trying to diagnose suspected, COVID cases with an expired test kit. The rest of Tigray does not have them. We now had a very vaccination. We thank UNICEF and WHO for facilitating that, for coordinating the vaccination. We have so far a significant number of vaccinated here in Mekelle, about 121,000 people, and they just wanted to go ahead and vaccinate people living in other cities and districts, but they were telling us they don't have fuel, they don't have cash. So again, another major block. The world is talking about, ending COVID as an epidemic by 2022, but we're struggling. So we're really worried. The people of Tigray cannot end outbreaks right now. They have had. So would like all uh, our listeners to really take this into heart and push, talk to international institutions, governments, and try to teach our people with the media available out there. Will do the same here in Tigray to protect themselves from, some of the outbreaks. The others might be very difficult to protect themselves even if we teach them. And I also call healthcare professionals in Ethiopia, our colleagues. You know, I just want to ask them: do you really know what's happening? We're not lying. We're not exaggerating. There's no point in saying that, and it's not right. We all have pledged to stand for patients. We're talking about patients here, people here. So, what's Ethiopian Medical Association doing, and the other professional associations? This is not politics. This is a humanitarian issue. So, I believe, we have to speak up. The restriction on everything has to be lifted. The world cannot be quiet. It's not proper.
Mhm. Dr. Amanel Haile, head of the Health Bureau of Tigray, has been live speaking with me on the outbreaks in besieged Tigray and the health challenges associated with that. We are very close to end the show, so I really hope our viewers heard you clearly in terms of the outbreaks of malaria, anthrax, rabies, and possibly cholera as well. And on the malaria, you were underlining the fact that this is a fatal one, the
Yeah,
fatal variant, and malaria has been under control for many years. And you were
yeah,
underlining the fact that the farmers of Tigray, who are already affected by their looted produce
yeah,
crops over the past a year or so, and they are still affected by the lack of fertilizer, seeds, all that. They are affected by
yeah,
the oxen, animals killed, looted, all that.
yeah,
And on top of that, you are saying that within the short window of sowing and so on, now the agricultural work,
yeah,
they are being affected by malaria, which is a deadly one, a deadly variant now.
yeah,
So
yeah.
you, in the report I saw and we reported on UMD Media, there were more
Yeah.
than 2,000 cases reported. Do we know any update on
Yes,
that?
it has continued the same. The number of districts that reported have decreased from 54 to 45. So the report we have obtained this week is what happened last week. So again, more than 2,000 cases are reported from 45 districts. So still, the epidemic is going on.
And your fear is, given this is not the major, even a minor transmission season, but this the
Yes.
major one comes in September, you are talking
Yeah.
about a reservoir for that, which could go
Yes.
out of control.
Exactly. Exactly. We can have hundreds of thousands of them being sick, and the devastated health system of Tigray and a very limited supply cannot really, stop this epidemic.
And lastly, how with your, do you have direct communication with the Ministry of Health of Ethiopia and with the international organizations like WHO, Global Fund, and so on? How does that work?
Yes, we have representatives of WHO, UNICEF, UNFPA, UNHCR here in Tigray. Of course, they get the reports. They also send those reports to their offices in Addis Ababa, and I'm 100% sure they know. Ministry of Health, we don't have a formal direct communication, but we try to communicate with them through indirect ways, talking to staff elsewhere in the world and asking them to contact the specific directorate. So there are people who are really willing to help. There are others who just turn a deaf ear to our pleas. So overall, Ministry of Health seems to be okay. The huge hurdle is, there seem to be layers in between Ministry of Health and structures that we don't know, that do not give clearance for weeks. The vaccine was ready, it was not cleared, so it's just sitting in Addis Ababa. So this is a big challenge that we are having.
Yeah, I think
And the health partners, they're having difficulty operating in Tigray with limited fuel, cash. They're not operating with even you know their full potential, far below that. So that has to be lifted as well. The world should not just keep see hardworking, honest people to die needlessly. Those people who die every day are human beings as well. And I believe the duty of every sane human being really address issues.
mm, mm. I hear you loud and clear. Dr. Amanuel Haile, who is the head of the Tigray Health Bureau, was speaking with me from Malala, with under the circumstance of very difficult communication, but hopefully the main message and the call is going out to our audience. Last, what is your worst fear, Dr. Amanuel Haile, given what you saw the executive director of IDER and the head of the medical school as well. Now, recently, a couple of weeks ago, you are the cabinet member of Tigray at head of the health bureau. What is your worst fear?
Well, this been happening over the last couple of years, as we have never seen them before, going back decades. But with every passing day, um, things are becoming very difficult. Trying to people is becoming difficult. So, is happening in thousands, hundreds, thousands, and even increasing. That's my fear. I have huge trust in the health professionals in Tigray. They have been stretched to the limits, but they were really faithful enough to their calling professions without eating at times or having little. And sometimes you would fear, they may break down. They have still kept their hopes moving ahead. But my fear preventable diseases with drugs that are available in the world. Rest of the world into the help people my
Hmm. Hmm. I think you broke up there. Can you hear me, doctor?
Yes, yes, I can.
Okay, great. I was not sure whether you finished. So thank you so much for your time.
Yeah.
And under the very difficult communication, I'm happy we were able to do this show, and hope to get positive news, soon. And I do really hope
Yeah.
to talk to you on another time. Thank you for your time, Dr. Emmanuel Haile, head of the Tigray Health Bureau.
Thank you so much, Professor Getachew, for the opportunity and for your patience. Thank you.
Thank you. Have a good night.
Thank you. To you.
You have been following us live with Dr. Emmanuel Haile, head of the Tigray Region Health Bureau. He's the head of that, and just recently, until recently, he was the executive director of Eider Hospital, the largest hospital in Tigray, if not one of the largest in Ethiopia as well. And he was also the head of the medical school of at Eider. Thank you for following up, and I hope, really hope our audiences put pressure on the international community, including Global Fund, to ask the right questions. Why and how this why this is happening and how it should be solved. Your host was Getachew Asapa. Have a good one. Bye.